A hearty good afternoon and welcome to the session on pelvic infection and infertility. We are glad to have Dr. Swati Shree among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Thank you. So today we are going to discuss on the topic pelvic infection and infertility. So present started now. Okay. So pelvic infections. First of all, what is the pelvis? So pelvis is the organ where in the lower abdomen. So and in the front it is the bladder or water bag where the urine is stored. In between is the uterus. Uterus is also called as womb. So womb, the tubes and the ovaries comes in the reproductive organs. These are the female reproductive organs which are the mainly constituting the organs of the pelvis. So any what is the pelvic infections? That means the pelvic infection is any infection of the organs of the pelvis. So pelvic infections are the infections that occur in the reproductive organs located in the pelvis, such as uterus, fallopian tubes and ovaries in women. Now coming to, so how to identify you have pelvic infection or not. So the most common complex complaints the woman will be having will be like any abdominal pain. So if there is, since a long standing, if there is lower abdominal pain, especially the pain will be low in the lower abdomen. So if there is any lower abdominal pain since long standing, or is there any, if there is any irregular bleeding, or there is some white discharge, abnormal discharge, and sometimes there is urinary disorders like painful when you are passing urine, or you are peeing, you feel the painful urination. Sometimes some people will have in the problem with the sex, that they may feel pain during sex, which is also called painful sex can be there. Sometimes there may be abnormal vaginal discharge. So abnormal vaginal discharge is one of the most common complaints. So if there is abnormal vaginal discharge, if you are not treating, it can lead to the infection of the whole of the tract, because the infection can move up and it can infect. So abnormal vaginal discharge is one of the common complaint, and also there can be irregular menstrual bleeding, sometimes spotting, irregular bleeding can be there. This, and if all these have been there and it has not been treated properly, it can really infect. The infection can become severe, and it can cause fever. So and the fever and nausea and vomiting, these are the things when they come after little later stage, when the infection has not been treated and infection was there since long time. So these are the basic symptoms of the pelvic infection. Now coming to causes of the pelvic infection. The causes of the pelvic infection can be many. Mostly there are either bacterial infection or the fungal infection or the or any viral infections, but most commonly the bacterial infections. And also these infections can be either chlamydia, gonorrhea, which are sexually transmitted infections. Other than this, there can be candidiasis, that is the yeast infection, which is not considered to be sexually transmitted. And there are many other like herpes infection, human papilloma virus infection. There are multiple infections which can happen. Even tuberculosis can also be spread, so that can also cause infection in the pelvic organs. So these are the multiple infections which can happen and which can affect the organs in the pelvis, which in long run can cause infertility, and we'll be seeing how it causes infertility. And what are the risk factors for getting these infections? So the risk factors for getting these infections are like age at first intercourse. So if it is at early age, the intercourse at an early age, first intercourse at an early age, multiple sexual partners, and specifically when they are not using any safe sexual practices, and the safe sexual practices involves using condoms. So if there is its use is not there, so then there is chances of transmission of the infections, and this can all generally affect. Use of IUD is intrauterine device. Most commonly which is used is copper T. So copper T, if is used, it is also forms one of this source of infection. But if proper hygiene is being maintained, it will not cause infection. But it can become one of the source of the infection. Previous untreated infection, like as I told earlier, if there is any abnormal vaginal discharge, which is very common in women, most of the women will have the vaginal discharge. So vaginal discharge is a normal thing to happen. If it is thin, watery colored, is discharge is there, and there is no foul smell and there is no itching. But if there is any foul smell associated with that, or there is any itching associated, or there is change in color, like change in color to yellow, green, or it's paper like white, curdy like consistency, so these all are the symptoms, these are all the signs that the infection is not normal, the discharge is not normal, and it is because of some infection, and you need to visit your doctor to treat that infection, because if it is left untreated, the infection can travel up and go and involve the uterus, tubes, ovaries, and can cause multiple problems in the future. Recent instrumentation of the uterus, so recent instrumentation either by the doctors in the proper, we all are doing every all the techniques in the proper is using proper septic techniques, but aseptic techniques, but there are sometimes if you are going to you many people are going to some places where there's proper aseptic techniques being not used, and irregular illegal abortions, these places are also there where the if there is proper asepsis has not been maintained, that can cause infection. And smoking is a risk factor, because many a times if there is infection, and our body also has some immunity to fight against these infections, so our body also tries to fight against the infections if we get any infection. But smoking affects our immune system, making it difficult for our body to fight against those infections. So smoking also forms one of the risk factors for the pelvic infections. Other risk factors are low socioeconomic status and illiteracy. These are some of the risk factors which causes pelvic infections. Now coming to diagnosis, so diagnosis of pelvic infection, so when you are having these complaints, when you go to your doctor and you visit your doctor, the doctor will listen to your complaints according to the symptoms what you are telling, and then we'll be examining you according to the examination. We'll examine your blood pressure, pulse, temperature, so if there is any fever which is sign of an infection, or there is pain, if you are having pain in your lower tummy, and we press it and we find that there is some pain, tenderness is there. And on in examination, many at times many of the infections we can examine, so if there is abnormal vaginal discharge, we can examine the inflammation in what is inflammation. So if there is any infection or any abnormal anything happens in the body, the body reacts the our body reacts it in the form of inflammation. So in inflammation there is swelling, there is redness, there is pain, so these are the signs of infection, inflammation. So when we examine, we do pelvic exploration, we do insert a speculum, or just examination. We get a feel of, or we have when we examine, you have any pain, any type of discharge. These all are one of the things which we help us in diagnosing the infection. Now, after we have some examinations, your doctor will advise you some blood tests. So these blood tests are basically to see for any infection is there. Many a times, many specific infections, for that also we do blood tests. Sometimes if there is any abnormal discharge, your doctor may take the swab sample from the swab, so that it is sent for the bacterial culture. So we in lab it is being cultured to find which infection is there, and which infection which antibiotic will be suitable to treat that infection. Sometimes we can do scan and we can find some problems with scan, and many a times when we do laparoscopy we can find some of the signs of the infection. So we'll see the what are the signs of the pelvic infection now. Excuse me. So these infections affect our uterus. So the uterus has the inner lining called endometrium. So endometrium is gets inflamed, same way the way I told that has some cells come to respond to that infection. It becomes inflamed, that is redness, swelling, these things come. The tube also becomes inflamed. So you can see this side, the healthy tube is there, the inflamed tube will be swollen. There will be swollen, they will be, the cavity will also be in the tube has the cavity which also will not go. Sometimes there can be some scar inside, and that will lead to blockage of the tube. there is effect on the ovary. See, you can see that a healthy ovary is normal, the inflamed ovary is having some swelling, redness. So these all affect when there is any inflammation in either the tube, either the lining of the womb or the ovary. They all affect the normal functioning of these organs, and these organs are vital organs for any fertility or any pregnancy to happen. Also in the pelvis, so the uterus, the tube and the ovaries are in continuation. The tubes are open ended, so they are open at one end and they collect the eggs. So what happens if there is any infection? It will come up, it will travel through the tube, and through the tube it will come out. It will affect the ovary, and it can also affect the surrounding structures. So that then it forms the scar tissue, and so that this when this scar tissue are formed, there is at several places the scar tissues are formed, and this leads to different, totally different architecture, or what we can say, the the scar tissue disturbs the normal relationship between the tube, ovary and the uterus, which is required for any fertility to happen or pregnancy to happen. So what is the effect of these? So the effect of these will be, if it is left untreated, there can be chronic pelvic pain. So the woman will have continuously will have some pain all time. There will be some pain will be there. It can cause to infertility, because for pregnancy to happen, one dominant egg should form every month. So if there is any inflammation of the ovary, this dominant follicle will not be formed, egg quality will not be good, tube should be open. So if there is tube is involved, tube will be having strictures, or tube will be closed, it will not be totally open, it will be having scar tissue. Or the uterus lining, the womb lining, endometrium is also might not be good, so that it can take up the pregnancy. So these are the effects which can cause infertility. Many times if there is pregnancy happens, so tubes become so much damaged that it doesn't let embryo to pass through it, so that it gets implanted inside the womb, and it leads to ectopic pregnancy. And many a times, if everything happens well and pregnancy also happens, the neck of the womb, cervix, if it is got involved or it has inflammation, it can later on lead to preterm labor, that is delivery before the full time of the 9 months. So these are the long term complications which can happen. So it is very important to identify these infections, pelvic infections, because they have effect on not only your uterus, they have effect on the tubes, they have effect on the ovaries, they have effect on the cervix, and in the long term they can sometimes they form a big abscess. So what is abscess? Abscess is a cavity where it is pus filled cavity, pus filled sac, cyst like structure which is filled with pus. So it can form in the pelvis, inside the pelvis, anywhere near the tube, in the ovary. It can involve the whole organ, and that can lead to some problems, which can lead to pain, fever. Then it might need hospitalization. We might need to hospitalize you, drain that abscess, start antibiotic, which has to be given in the injectable form. So this way the abscess has to be treated. If it spreads, if the infection spreads to the whole body, that is called sepsis. In that condition, the treatment will be to give you injectable antibiotics, and many a times woman may need admission in the ICU. And but if it is at the very early stage, the simple antibiotics, simple hygiene methods, these can all treat the in pelvic infections. So pelvic infections can happen, and these are some of the complications. But pelvic infections do happen in males also. In males, they can affect the epididymis. They can affect the prostate. So if these organs are affected, then it can also affect the formation of the sperms in the male. So if that happens, that sperm formation is decreased, then in that condition it can cause male infertility. So this is how the pelvic infection affects male also. So it is not only that the females which are being affected in the pelvic infections. So in pelvic infections in males, they cause inflammation, scarring, and lead to sperm decreased sperm production, or they can interfere with the production. Or if it is sperm is produced, there will be more damage to the sperms. The sperms will be damaged, and also that can affect its ability to move forward or ability to fertilize the eggs. So these all can lead to the male infertility also. So there are, we can see that there are multiple ways. These are the simple infections which is very easy to find out, very easy to see inside you because of the symptoms which I told, like abnormal vaginal discharge, lower tummy pain, any pain during urine, pain in the sex, irregular bleeding. So these are the simple symptoms. If you identify at your correct time, you can visit your doctor correctly, that can be diagnosed, and we can prevent these long term complications, and out of that infertility, which no one could have thought that this small infection can cause infertility, because it really has a great effect on your the lining of the womb. It makes it very unreceptible, that it cannot accept, it will the lining will not grow in the woman. If they are going for infertility treatment, in those women also it becomes very difficult to do IVF also, because the lining will not grow properly. Or if the lining is growing properly, but they are, we can see in the scan, we find it is growing properly, but they will not be very good to receive the embryo. So they will not be very good receptive. So that can be the problem. And that if the tubes are affected, I told ectopic pregnancy can happen, tubal blockage can happen. If there is tubal blockage, natural pregnancy is definitely no, will not happen. So this, that's way it affects. If both the tubes are affected, it will block the tube and cause infertility. Or if there is pregnancy, then it can cause ectopic pregnancy. Ovaries, it can affect the egg quality. And again, I will say that if the relation is damaged, if the relation between the ovaries tubes and the uterus is disturbed, then it causes the disturbance in the movement of the egg, it causes the disturbance in the movement of the sperm, and it makes the environment very toxic for the sperms, ovaries, or the embryo to grow inside. So this is all about how pelvic infections affect you, and it not only affects the at present health, it also has a long term effect, especially in the infertility. And not only the infertility, general health it affects. So if you are experiencing any of the symptoms of this pelvic infection or have been diagnosed with one, it is important to seek prompt medical attention to prevent complications including infertility. And early diagnosis and treatment can help prevent permanent damage to the reproductive organs and increases the chances of successful conception. So, with this note, I would like to end my discussion. Any questions are welcome. Thank you from my side. Okay, thank you all.